We have a vision for the future of general practice. This is what it could look like. Peter leaves for work early and gets home after his practice closes. He can speak to a GP on his mobile during the day, access his own practice on Saturdays, or see a local GP until late in the evening. Each practice has his medical records, so they know his medical history. He can also email the practice and get clinical advice within 48 hours. This means Peter can schedule his healthcare around his work commitments. Seema is a member of a young mum support group, organised by local health visitors in partnership with the general practice. Here she meets other mums and learns what they do when their babies are ill. This builds her confidence to care for her daughter and has reduced the need for ad hoc appointments. If she is worried about an urgent issue, she knows she can speak to a GP from her practice the same day within half an hour of calling. This makes her feel supported and reassured. AJ has COPD and diabetes. He also has arthritis in his hip and knees. He has been in and out of hospital and attended A&E with breathlessness several times. AJ now has a care plan, which is reviewed frequently with his care coordinator to see what extra support he needs from his wider care team. His community pharmacist has reviewed the range of medicines he takes with him. Now AJ understands how and when to take them and is optimizing their use. He also knows what to do when he gets breathless. He hasn't been into hospital for over a year. It means he is better able to manage his care and stay healthy and independent at home. He feels a greater sense of control, ownership, and support. Annabelle's husband Michael was diagnosed with early onset dementia. Things had become very difficult. He couldn't leave home alone because he'd get disorientated and lost. Annabelle felt increasingly isolated and worried about her own mental health and became very dependent on her GP. The GP arranged for a health and well-being coordinator to visit them at home. He spent time with Michael and they talked about his love of cycling. The coordinator arranged for volunteers from the local cycling club to visit Michael. They now take him cycling 2 afternoons a week, and Annabelle now has some much needed time with her friends. Dennis is feeling unable to cope with the pressures of life. He has a phone consultation with his GP, who arranges a 30-minute appointment. The GP learns that Dennis has become inactive and lonely since his wife passed away. The practice helps Dennis to join a local rambling society, where he meets new friends who live locally. The practice often calls him to see how he is getting on. He now feels less isolated and more able to cope, and values the relationship he has developed with his GP and their team. Derek's GP arranged for a stroke association coordinator to visit his mother Maureen when she was in hospital following a stroke. As soon as she was discharged, the coordinator also visited her and Derek at home. The coordinator gave them information on what had happened to Maureen, how to prevent further strokes, and support from the stroke association. The association's help eased Maureen's recovery and stopped her becoming isolated and dependent. It also relieved some of the care pressure on Derek. It won't be easy to realise this vision for London, but we believe that together we can do it, and now is the time.